As of this month, according to the World Health Organization, there have been over 500 million cases of COVID-19, resulting in more than 6 million people losing their lives. According to the Journal of Medical Internet Research, as the virus spread exponentially, so did its media coverage, resulting in a proliferation of conflicting information on social media platforms, a so-called infodemic. As the virus spread across the United States, media coverage and information from online sources grew along with it. Among Americans, 72% report using an online news source for COVID-19 information in the last week, with 47% reporting that the news source was social media. The number of research articles focusing on COVID-19 has also grown exponentially. More research articles about the disease were published in the first 4 months of the pandemic than through the entirety of the SARS and MERS pandemics combined. Unfortunately, this breadth of information and the speed with which information can travel sets the stage for the rapid transmission of misinformation, conspiracy theories, and fake news about the pandemic. One study found that 33% of people in the United States report having seen a lot or a great deal of false or misleading information about the virus on social media. The Director General of the World Health Organization referred to this as an infodemic because of the accelerated flow of information about COVID-19, where much of it was inaccurate. This trend of misinformation emerging during times of humanitarian crises and propagating via social media platforms is not new. Previous research has documented the spread of misinformation, rumors, and conspiracies on social media in the aftermath of the 2010 Haiti earthquake, the 2012 Sandy Hook Elementary School shooting, Hurricane Sandy in 2012, and the 2013 Boston Marathon bombings. Even as citizens, social media platforms and policymakers converge on the notion that false and misleading information are urgent problems. The methods used to address the issue have had mixed results. When social media platforms crack down on bots and misinformation, either through automated techniques or through manual content moderation, they run the risk of censoring online speech and further disenfranchising minority populations. For example, algorithms designed to detect hate speech were more likely to label a post as toxic when it showed markers of African American vernacular English. According to the Journal of Preventive Medicine and Public Health, the pressing issue is that the fake news spreads more rapidly on social media than news from reliable resources, damaging the authenticity balance of the news ecosystem. The COVID-19 pandemic has not only caused significant challenges for health systems all over the globe, but it has also fueled the surge of numerous rumors, hoaxes, and misinformation regarding the etiology, outcomes, prevention, and cure of the disease. Misinformation and rumors regarding the COVID-19 pandemic are hindering the practice of healthy behaviors such as hand washing and social distancing, and promoting erroneous practices that increase the spread of the virus and ultimately result in poor physical and mental health outcomes. A myriad of incidents and mishaps caused by these rumors have been reported globally. For example, in India, a father of 3 was reported to commit suicide upon learning that he had been diagnosed with COVID-19. Another example of hazards attributable to improper health communication can be drawn from Nigeria, where the health officials found several cases of overdose of chloroquine, a drug used to treat malaria, after news of the purported effectiveness of the drug for treating COVID-19 spread through news media. Rumors about a national lockdown in the U.S. fueled panic buying of groceries and paper products, which disrupted the supply chain and exacerbated supply and demand gaps, as well as food insecurity among individuals with low SES status and other vulnerable populations. Similar phenomena have also been observed in other economies around the world, which may have prolonged the impacts of public health, nutrition, and psychosocial impacts to health among the affected populations. The widespread misinformation related to the diagnosis and treatment of COVID-19 has confused both the general population as well as healthcare providers. Stories like these just further prove the impact that this information can have on human well-being and health. However, it is important to remember that we all have real influence and impact on social media, as well as in real life. Not just those who knowingly spread misinformation can make this negative impact. The misinformation has to be circulated and discourse has to occur. We all can play a role.